We want to get to the latest now in a warning about a possible outbreak of measles. Public health officials are concerned hundreds of airline passengers and workers may be infected after coming in contact with an infected woman from New Mexico. Joining us to break this down is CBS News medical correspondent Dr. Jennifer Ashton. So this is a woman who traveled through multiple airports on multiple aircraft, which of course then continue on to other destinations after she is done with them. As a physician this morning, how concerned are you about a potential outbreak?
Well, Erica, there's cause for concern. There's no cause for panic yet. We spoke with an infectious disease expert last night who called measles the most contagious virus there is. So if you talk about the numbers, we know it can have a 2-week incubation period, which means you can be exposed and not become sick for 2 weeks. It's spread via airborne particles or direct contact. Those particles can live for 2 hours, and you can be potentially contagious for 9 days. So when you talk about airport travel, that's a lot of potential people.
And those numbers, the fact that it could take so long to develop. The good news in this country is most Americans, a very high number, have been vaccinated. We're told that this woman may have chosen not to be vaccinated. Lay it out for us. What are the real risks here, and what could we be looking at?
So when you talk about the signs of measles, Erica, it typically begins with a fever, and that fever can be quite high. It can be as high as 104 degrees. And then you can get a cough, some red eyes, a runny nose. There's a classic patches that we see in the mouth. And then there's a rash that typically starts on the head and face and work its way down the body. Now, in terms of complications, most of the time this goes away without any treatment, but potentially we can see things like pneumonia and inflammation around the brain called encephalitis, or eye problems. Most susceptible are babies who have not been vaccinated, pregnant women who have not been vaccinated, and anyone with a weakened immune system.
And of course, most importantly, if you think you may have been exposed, go see your doctor.
Absolutely.
Jen, thanks.